Is surgery truly needed to reverse type 2 diabetes? The debate over whether surgical intervention is essential for reversing type 2 diabetes is intensifying, as mounting evidence suggests that aggressive dietary changes alone can achieve similar, and sometimes superior, results. While bariatric surgery has become increasingly popular, driven by high remission rates, a closer look reveals that the benefits may be overstated. The rise of metabolic surgery. The surgical community has rebranded bariatric procedures as metabolic surgery, framing them as more than just anatomical rearrangements. They argue that these procedures alter digestive hormones, leading to unique physiological advantages. Indeed, studies show roughly 50% of obese individuals with diabetes and 75% of those with severe obesity enter remission after surgery defined as normal blood sugar levels without medication. However, the question remains, is the surgery itself the key, or is it simply the extreme caloric restriction that accompanies it? The caloric restriction factor bariatric surgery often necessitates a drastic reduction in caloric intake, both before and after the procedure. This raises a critical question. Could this dietary change, rather than the surgical manipulation of the digestive system, be the primary driver of remission? Researchers at the University of Texas put this to the test. They compared two groups of patients scheduled for gastric bypass. One group underwent surgery followed by an extremely low-calorie diet, under 500 calories a day, while the other followed the same diet for 10 days without surgery. The results were striking. Caloric restriction alone led to comparable improvements in blood sugar, pancreatic function, and insulin sensitivity. In some cases, the non-surgical group even performed better. The liver's role and the personal fat threshold. Type 2 diabetes is increasingly understood as a condition driven by fat accumulation in the liver and pancreas. Everyone has a personal fat threshold, beyond which excess fat spills over into these organs, causing insulin resistance and eventual cell death. Extreme caloric restriction can reverse this process, mobilizing fat from the liver within days and normalizing pancreatic function within weeks. The research shows that losing even 5% of body weight can shrink a fatty liver by 10%, making surgery potentially unnecessary for this initial improvement. Weight loss. Surgery versus diet. The data suggests that significant weight loss, regardless of method, can induce diabetes remission. Losing more than 30 pounds, 13.6 kilograms, can put nearly 90% of those with less than 4 years of diabetes into remission through diet alone. For those with longer-term diabetes, the remission rate drops to 50%, but still remains competitive with surgical outcomes, which achieve around 75% remission for those with up to 6 years of disease and only 40% for those with longer histories. Notably, weight loss achieved through diet alone appears to improve systemic inflammation markers, while bariatric surgery can sometimes worsen them. Long-term implications and complications. While surgery may improve kidney function in diabetics, it doesn't necessarily prevent diabetic vision loss. This suggests that surgical intervention addresses quantity of dietary change, but not necessarily quality. Moreover, long-term studies have shown that intensive lifestyle programs focused on weight loss don't always translate to increased longevity or reduced heart attacks, highlighting the importance of sustainable dietary habits beyond mere caloric restriction. In conclusion, aggressive dietary changes, particularly extreme caloric restriction, appear to be a powerful tool for reversing type 2 diabetes, often rivaling and sometimes surpassing the benefits of surgical intervention. The focus should be on accessible, sustainable weight loss strategies, rather than solely relying on invasive procedures.